For us, medicine is not a profession, it's a way of life. And so we always want to ensure that whatever we do for our patients, it's the best decision, it's rooted in evidence, and that our patients and their family members are very comfortable with us.
For a lot of people who are having episodes of atrial fibrillation, they may notice things like fatigue, maybe decreased exercise tolerance, maybe shortness of breath, palpitations, heart racing. One of the important components of treatment of atrial fibrillation is preventing strokes. And one of the things that we have on FixAfib is a risk calculator so that we can see, and you can see, what is your overall risk for developing a stroke in relation to the atrial fibrillation. The best way to reach our office would be through the website. There's a form that can be filled out. I would be then the person who would contact you and just get some more information about your history with atrial fibrillation, and really importantly, what are your goals in care? Is your goal to get off of all your medications? Is your goal to really minimize any invasive procedures? Is it to get back to living and doing what you want to do as quickly as possible? From there, typically it would start with a meeting with Dr. Laws. He will ask you many questions regarding your atrial fibrillation and also about the risk factors that help to contribute to why you developed atrial fibrillation in the first place.
We have lots of patients who've been referred to us. Once we have set about with aggressive risk factor modification, some of these patients no longer require ablation procedures because we've controlled their atrial fibrillation just by controlling their risk factors.
From there, if the plan is that you would be moving forward with some type of procedure like an ablation, we have a series of diagnostic evaluations and tests that we do, specifically a CT scan that we do to create a model of your heart.
We think it allows us to better understand the patient's anatomy and better understand how we are going to tailor our approach to the patient. I give you an example. We have some patients where the common pulmonary vein is extremely large. Instead of doing the traditional catheter ablation or cryoablation, we may decide to do a laser ablation. And it so happens that to date, we are the only center in Colorado that actually does laser ablations for atrial fibrillation. We tend to get to know our patients individually. And so by the time we've gone through all the various iterations and various approaches, we said, well, now it's time for us to dive into the actual procedure. I think everyone tends to be more comfortable with us because they've known us over the course of time. And we emphasize the whole shared decision-making process here, where everyone comes together to arrive at this conclusion that, yes, we think this is a procedure that should be done.
After you get discharged home, we typically send people home with a few different medications that can help to decrease the inflammation within the heart. And what we found is their risk for complications after the procedure has been greatly reduced, and therefore their downtime after the procedure is really reduced, and so that people can get it done and do their recovery and then get back to life. Throughout the process, one of the things that we find really helpful with our patients is to be really available. You can call and we can have a conversation about what the questions are that you have about your disease, what your family member asked you after you got off the phone with me the last time, and or whatever comes up, and we're just here to help you throughout the process.
I mean, it's not just, an 8 to 5 operation here. I mean, it's a 24/7 operation. We have patients who interact with us at 3 o'clock in the morning. We have patients who interact with us at 10 p.m. at night. And we're always there for our patients, and we want to be sure that when they leave here that they said, well, this was probably the best decision I've made.